whenever you're ready.
Good evening. My name is Bill Stauffer. I'm zooming in from the United States. I am the executive director of ProA. We are the statewide recovery community organization of Pennsylvania. First and foremost, I'm a person in long-term recovery. I've been in recovery for 38 years and involved in our space for most of that time. Here in the US, I've done things like testified in front of our Senate twice in relation to matters of recovery. I'm a writer in our space and have been honored to write with thought leaders such as Bill White. And I train on recovery around the nation, as well as write about matters of recovery and recovery history. And it's a deep honor to be with you here this evening to talk about navigating our future by thinking about where we have been in the past and where we are going. Thank you again for the opportunity to be with you all here and our friends in the United Kingdom to talk about recovery. First, our reality. As a student of history, and I became interested in recovery history as I learned more about my own recovery history and people whom I had never known, whose work influenced the things that I needed before I knew I needed them, and they were there when I did need them, as well as the ups and downs of our history. And the more that I've learned about our recovery history, the more humble I've become about our own contributions, and the more urgent I feel about what we can do to learn about the past and how, as we learn about the past, it may influence what we do moving forward. The thing that I would most want to emphasize to begin with for listeners, viewers, is that our history is not linear. There's not this pathway of constant forward momentum. There are ups and downs in our history, both here in the US and from what I can determine also in the UK. We have curious parallels actually in our histories, which makes it absolutely fascinating to me. But we face strong headwinds, things that get in our pathway that slow us down, and we have internal tensions, our own infighting and things that we do that diminish our message and make it more confusing and difficult to move forward. It's also true that everything we have is from our own efforts. If you dig deep enough into recovery history, it's people who have lived experience and those who are closest to us, our recovery allies, who have dedicated their lives to this space that move things forward. And sometimes that passage of the movement of things takes incredibly long. But we have to honor, at least from my perspective, we have to honor all of those people who have come before us. And we want to think about how those lessons inform what we do moving forward. First, some uncomfortable truths, and this is true both in the UK and the US. We're poor historians. We have failed to record our own histories. Here in the US, William White, who's been a mentor of mine, spent 20 years cataloging the history of recovery back through colonial times into Native American traditions, but he only scratched the surface of that history. Recently, I did a fellowship at one of our treatment centers, Hazleton Betty Ford, which is a well-known organization, and they have a specialty library, a special library on addiction and recovery history. It's one of the few remaining in the United States where they have cataloged all kinds of information. When I visited this library, I learned that there used to be nearly 200 of these similar libraries, both in government institutions and private institutions around the world, and there's only a handful left. So closures of specialty libraries and places where there's information about our own history has been the norm over the last 20 years. And even beyond that, most of our history has failed to even be recorded. There's whole swaths of things that nobody bothered to write down. It's something we want to think about also about what we're doing now. Is for all of you out there in the UK who are listening and spreading recovery around your communities and doing things to make it visible and the reality that we can and do recover, you're making history, and you should take efforts to write things down so that people can understand what you've done, what you've learned, and how to move forward from it. Another truth is that um, we cannot develop a unified vision of where we need to go forward unless we can figure out what it has taken to get us to today. Now, this is a lesson from the United States, but we had something called the Washingtonians. They rose up around 1840, and essentially what they did, alcohol use was rampant. People drank huge amounts of alcohol. Public drunkenness was extremely common. People drank gallons and gallons and gallons of beer and other beverages, um, and it became a problem in the country to the point where there was a movement for people to not drink, and the Washingtonians did a pledge to not drink, um, and it took over the country. There were hundreds of thousands of people who had taken this pledge. It's important to note that not all of those people had severe alcoholism. Some of them took the pledges out of pressure, spouses and potentially employers who wanted them to reduce their drinking, and they may not have even had a commitment to not use alcohol, but the pledges were common. The movement included people who would speak out about their own experience with alcohol, which, as we think about that, the traditions of telling our stories was something that had predated that era in our country, and certainly had took hold in that era. Uh, but it also led to some leaders making a lot of money, sort of on the speaker circuit, and they began to put their own interests before other people. Um, the movement captured national attention. There's actually a speech by Abraham Lincoln about it. But more importantly, and I think one of the things that why I reference this particular movement now is that they became embroiled in politics that exceeded recovery. They went beyond a focus on recovery and became focused on things like temperance, whether the U.S. should have prohibition on alcohol, and there's strong lessons there about where we focus. For those people who come from 12-step traditions, that lesson is why groups like Alcoholics Anonymous and Narcotics Anonymous have pledged to not have views on outside interests, because they look back at that history and realize if we get involved in other things, it would be destructive to us. We should also think about that, and how many of the political movements around things in our space that we want to become involved in, or how do we keep our focus primarily on recovery and long-term recovery for our friends and families and neighbors. As a result of these kinds of things, internal arguing, not having a clear focus, not having clear leadership, interests of money, it dissipated within a few years. By 1845, it was almost gone. So it came and went in a flash. I could spend time talking about other recovery movements and other eras of history, but I'm going to move up into the late 1960s. Also, in a parallel in the UK, we both had there was a drug culture that took hold in the late mid to late 1960s, both in the United States and in the UK. And as a result of that, there became an interest in doing something about it. When we look at our own history here in the US, we can trace back early people who were early in the 12-step movement, people like Marty Mann, who had developed a focus on alcohol and educating the public about alcoholism. They became really important because in that era, there was a senator named Harold Hughes. And one of the things that's very clear in our history is that Harold Hughes was a person in recovery. He was a truck driver, ran for office, openly acknowledged that he had had a drinking problem. And because of the way he got elected to the governorship of Iowa, moved to the US Senate. And when he got there, he recognized it was a timing too. Addiction was becoming more prevalent in the US. And he worked to get public funding for services in the United States. And he brought people together in that era to testify, to change the way that our government funded these things. And this is the first era of of a modern recovery movement in the United States. One can trace our treatment histories. Our treatment programming around addiction and recovery came out of this era. Many of our counselors and people who were in clinical settings, one could consider in that era as being people who were in this initial movement. It captured their imagination. They were often dealing with people in their own communities and people that they cared about, and they wanted to move that forward. It's also important that that effort did not last forever. Around 2 decades later, it really started to dissipate with things like the war on drugs. This came from the increase of crack cocaine use, and a public perception that drug use was dangerous. Certainly, one in the US, we had a just say no uh, sort of focus on drugs as simply the idea that that people have a choice to use drugs or not to use drugs, and only bad people use drugs. And this had a chilling effect on people in recovery because of that moral implication. And at the same time, we changed the rate of our incarceration, and we were incarcerating people at higher rates during that era. I got into recovery in 1986, the same month as something called the Len Bias Act passed, which made crack cocaine penalties 100 times greater than powder cocaine, and huge numbers of African Americans were sent to prison. But the whole thing had a highly chilling impact on efforts to strengthen recovery. In this period of time, Harold Hughes had left the Senate, and he had attempted to start the first national recovery organization, which was called SOAR. And it didn't, it failed. It had brought together many people, but it had challenges in funding, and it was going against that headwind of moralism and the sense that people who use drugs are bad. It became harder to stand up and be seen as a viable citizen in recovery because of the overwhelming messages that were being sent out. I was in school as some of this took off the ground. I remember things like users are losers were kinds of the messages that were being sent to kids to try to just get them to say no. And of course, we're well aware that it's never that simple. We know that in recovery. So, this is something that I have studied a significant amount, um, and I lived through it. I lived through portions of this as it came to be. Um, but in the mid 90s, we started to see a dramatic downturn in people being able to access treatment. That we have a different type of health system in the United States, but insurance companies kept people out of it. There was no organized recovery community to push back against that. And there may be parallels to that in your system where the system just does what it does and they're not really listening to the impacted communities. But I lived through it and I watched a lot of people get harmed. And the community across the country started to rise up and realize that was having a very negative impact on their own communities. And at the same time that was happening, I had referenced that in an initial stage of the recovery movement, much of our treatment systems had people in recovery who were involved in them. And as the treatment system matured, we started to over professionalize and force people in recovery out. Full disclosure here, I got into the field. I've done clinical care. I've run residential programs and outpatient programs, but I got in with a high school diploma, and I went and did get an advanced degree after getting in the field. But a few short years later, that access, that way into our field was unavailable because we had shut the door for people who were in recovery to get into and advance in our field. The other result of that was our field, which had in an earlier generation a sense of the culture of recovery. Many of the people who worked in our field understood how to get people from clinical care and connect them to communities of recovery. That became lost as there was an overemphasis on college education, and the people who were in our field didn't understand recovery. They may have understood the pathology of addiction, but they did not understand the resiliency of recovery. So as a result of this, this movement came forward, and organically people started to talk about this around the country, uh, and begin to change how things were done. We also, around the same era, we were lucky enough to have servant leadership in our federal government that listened to us, and started to recognize that there needed to be some organization and advocacy for recovery, and that clinical or professional services could not meet all the needs. Dr. H. Wesley Clark, who was our leader at CSAT, Center for Substance Abuse Treatment, was that individual who recognized and listened, and that government leadership that listens is something that doesn't always happen. We were fortunate enough to have it in that era. Out of all this, groups came together, and there was a meeting in St. Paul, Minnesota. Out of this meeting, importantly enough, one of the things that happened was Faces to Voices of Recovery US came to be. There was a recognition that we needed a national organization by us and for us. And people came from around the country, and it was a fairly remarkable event. I was not present at this. I know many people who were. I've interviewed a lot of people who were, and they recognized that something was really important was happening. They came up with three primary goals: to celebrate recovery in all its diversity. And we're celebrating Recovery Month, right? To foster advocacy skills in the tradition of American advocacy movements, to get it out there that we can and do get better, and to start to change our system, to produce principles, language, strategies, and leadership to carry it forward beyond those present. I have to say a few things here. One, the people that did this were mostly just regular people. They were not politically powerful. They were not particularly connected. They were people in their communities who saw the damage of addiction, understood the promise of recovery, and just became determined to change things. William White, the writer, referred to them as the little engine that could. They didn't know how they were going to make these things happen, but they decided to do it anyway. And I think it's remarkable. And I think we want to pause for a minute here and think about. I think that these efforts, just based on being here on this call, which I'm honored to be a part of, influence things around, beyond the U.S., and touched a chord internationally about the value of recovery and how a recovery community can come together and change things. I would also say that there wasn't anything particularly special about that time either. And I'm going to hazard to say here, well, first I'll note that we are here in the US, in the addiction and recovery space, like remarkably good at arguing among ourselves about a lot of different things. And one of the reasons I actually became interested in documenting and learning about this period of time is that I lived through it. And what I know from that era is that we argued about as much, or perhaps even more back then, than we do now. So I would want to, if anybody has a sense that during those good old days, everybody agreed on everything and that's how they got it done, that's not true. What happened was these people realized that there was some important work to be done, and that it was vital to set aside any kind of differences that they had, and to figure out what they could come together on. And they realized this, that they needed to do that if they were going to achieve anything at all. And they realized that oftentimes we burn each other down, and the outside groups look at us and don't take us serious. It's very hard to move something forward politically without a unified message, and they understood this. And so, I think for me, there's hope that if they could do that, we could also. Um, and and history shows us that they were no different than us as far as their capacity to argue about things. They did quite a bit, but they put those things aside. One of the reasons, though, that they had done that is this book, Slaying the Dragon, had just come out. And it's the life work of William White. I mean, he's done tremendous other things. If you haven't heard of William White, I would strongly recommend that you look him up. He's done some writing on the UK recovery history. By the way, I think somebody should document your history. And if anybody's got an inkling to do that, that's listening to this, I really, having a recovery perspective history is really important. But they read this history and they realized how vulnerable it was, because what William White documented was all these times that it rose up and it fell, and things like people, what he called hucksters and hustlers, people selling patent medications. We had something here in the U.S. called the Keeley cure, which in the early 20th century was sold as gold. Like, they had gold in a liquid form and they had people drink it, and it was supposed to cure addiction. And pretty much it was alcohol and opioids. And so it was a false thing. We've had many of those types of things. We have commercials for people who have the cure for addiction all over the place. It has always been that way. So we have these groups that take advantage of people with addictions. We have external groups that have different messaging. And they had read our history and they had understood that these were things that had to be overcome if they were going to work together. They listened to each other. They put aside their own agendas for common purpose. And there was a recognition that they could do something that would have lasting value. I think, history shows us that they did. And it should be honored, and we should understand that. Also, we should understand from their perspectives what they thought they could do better. And in some of my writings, I've documented through interviews with people some of those things. But one of the things that I think, at least from what I can see over here in the States, there were different concepts. And as I became active in the recovery movement, moving from the clinical side to the recovery side, these things were really very prevalent. Everybody in the recovery space did things like stay in our own lane. Like, our focus was on recovery. Oftentimes there were other issues like prevention, treatment, and harm reduction. These things that we had overlapping interests in, but primarily our focus was on our own lane, which was recovery. There was transparency and inclusion. We were really open about the kinds of things that we were doing and what we wanted to achieve, which was to get more people into long-term recovery in America, and have people in recovery being part of that process. Nothing about us without us was the rallying call of people in that generation. There was a recognition that everyone was a leader and no one was a leader, that there was no king of recovery or rock star that spoke for everybody, and that everybody had something to offer. Things were done in that era like letters that were behind people's names. I mean, I have a few letters behind my name, but if you would go into a room, they would remove all your letters. So if you had a PhD or you were a person in recovery, your perspectives had equal value. So there was a recognition, like, we needed to honor everybody's perspective. There was a sense that authentic recovery efforts come from us collectively, that we all had something to do. And there was an emphasis on honesty, humility, tolerance, positive regard, mutual respect, gratitude, forgiveness, and service. So these kinds of things, really pulled people in to this movement. And I think these are steering concepts that we at least here in the U.S., I think some of them have been lost, and we should be mindful of what may happen if we stray too far from them. One thing that did happen, and William White, again, this historian, I referenced a paper of his here State of the New Recovery Advocacy Movement. It actually was a keynote address that he gave in Dallas, Texas. And I actually happened to be standing there. He did it outside. It was a nice, beautiful day. Texas was nice and warm in November. And I recognized as soon as he started to speak that the kinds of things that he was saying were absolutely things that we needed to pay attention to. And he later, he had a written one-page bullet points of the thing, and I have it to this day. I rarely save things that long, but I did. I scanned it. I have it. He later turned that into a full-length paper, and he warned of things like colonization, and that would be outside groups with other interests coming in and taking over our ideas, the things that we have developed, our concepts, our language, and using them for other ends. That is a risk. Professionalism. We, particularly here in America, we have this capitalist system, and there's always people looking to take the kinds of things that come from the recovery community and make a profit out of it, and then limit the number of people who could do it. And that has risk to authentic recovery. We tend to, my own observation of our history is we end up limiting ourselves. We make it harder for recovering people through that professionalism, probably because we all have that same stigma is so pervasive in our societies that we think that if we make it rougher, that we'll be taken seriously. My own sense, and then that commercialism and anything to make a buck, whether it's people taking advantage of us, drug merchants. Here in the U.S., alcohol, the sellers of alcohol, cannabis, which in some places is legal, in other places it's only medical, but only even places where it's medical, they're sort of preying on our community. And these things, they have a vested interest. All of these groups have vested interests in sort of taking over our space. I would observe that something like 20% of the people use 80% of the substances. So industries like the alcohol industry and the cannabis industry and even the pharmaceutical groups have an interest in heavy users. So I kind of view people in recovery as a lost market for them. And so they, getting people who are in non-using recovery to experiment with cannabis and things like that and turn them back into heavy users is really in their interest. And we should have, agree or disagree with me, that's fine, but we should have discussions around those things. They're things that I'm seeing every day, frankly. So common challenges that I can see, and I'm certainly no expert on UK recovery history. I'd really love to hear different people's perspectives, but I do think that we have a Tower of Babel of language where we can use words like recovery or treatment or peer or harm reduction or prevention, and we could be using the very same words to mean very, very different things to all of us. Many years in recovery where I'm saying something to somebody and they're disagreeing with me, and it took me years to figure out that the words that I was using had very, very different meanings to them than to me. And I think we should establish that sometimes that our language is getting in the way, even as we're using some of the same words. We have a tendency to focus on acute care options. We limit long-term recovery options. It seems like the one thing that we tend to avoid are long-term solutions. And long-term solutions invariably involve communities of recovery. They're not short-term. All of the rest of the stuff is great. I'm not knocking medications for recovery. Many of my friends have found recovery through medications. I'm not knocking clinical care. I was involved in clinical care for many years. But if you move forward and you look out, most recovery after those acute phases tend to happen in people growing in communities. And it's the thing that we tend to not focus on enough. We have a pathology orientation and not a resiliency orientation. Here in the US, and from what I can tell in the UK, we have warehouses full of data on the pathology of addiction and just a couple scant file cabinets on recovery and almost nothing on long-term recovery and how to get people there. And that should be reversed. We should be researching the solutions, not just the pathology. And when we do that, I think it goes to recovery community capital. So things like what you're doing at Faces and Voices of Recovery UK are vital to that effort, as we're seeing also here in America. Uh, and it's also, there are no end to groups that take advantage of people who have active substance use disorders or those of us who are in recovery. We need to uh, be aware that there are groups of people who see us as a commodity to capitalize on instead of a community to collaborate with. So, what we can learn from all this is that our history is not linear. What has been gained can be lost. Even as we're celebrating Recovery Month, I mean, I've seen here in the US, I've seen shifts from most of these celebrations being about authentic recovery and highlighting people in recovery and communities, that some of them are starting to turn into like political events where political leaders sort of talk about how well they've done, and the people in recovery are sort of tokens on the side. We have to watch out for that. We have to keep recovery central to our messaging and have some control over how these things are done. Knowing our own history, things that we can do to get in our own way, infighting, focus on our own gain over the gain of others. Khalees Connor talks about I to we, which I like so much. I think I've mentioned it every time that I've brought this topic up since then. That's an important comment. We need to focus on our common ground issues. We can achieve great things together, but to come together, we have to figure out what's important to all of us to make those things happen, so that we can, those other things we can deal with at another time rather than the things that we can commonly work on. And developing leaders really need to understand this history. And my own research into history is, and I suspect that you'll agree with me over in the United Kingdom, that our systems are not working well. They're not working well here. From what I can tell there, they could be better as well. But it's also the case that several generations of people have worked very hard to get us what we have today. And nobody has ever achieved everything that they set out to do. So we have to have some humility about what we could do, and then also some gratitude for what they've brought to us at this point. Sometimes I see people who do not understand our history, like kind of want to burn it all down, and thinking that then that would be better. And I think if we burned it all down, all of those groups that have economic interests in recovery would take over our space. I don't think burning it down. I think learning from where we are in incremental is really important here. But these are things that are really quite important. Moving things forward, we should be having discussions regularly in our communities, locally, regionally, nationally, and internationally about what has worked to date. What are some examples of things in the past that have worked? I started researching the new recovery advocacy movement when I was starting to get really down about things that I was seeing, and I needed to spend some time figuring out what worked and listening to people who had done that and their perspectives on where we were at now. What did not work? In our country, talking to some of those same people, some of them had wished that we had spent more time building a common platform rather than what happened. And they achieved great success, but essentially what we did is got really excited, came up with some stuff, and then ran with it. And a couple of people that I interviewed said we really should have spent more time focused on building that common ground between us. Their perception is that we would have been able to have even greater success. What conditions lead to positive change? And from what I could tell, those steering concepts, people coming together, putting aside differences, focusing on recovery as a primary goal were things that worked. And then what can erode our efforts? And that could, I before we erodes on our efforts. Outside groups who want to colonize our space uh, can erode our efforts. Moving our focus from recovery to outside political issues can erode our efforts. There are many more. And they may be different for you than us, but there's probably some similarities. I'm sort of struck by a lot of parallels in our history. Then we want to think about how do we communicate what we know to the next generation. I think I'm a reader, and I love quotes, and I think well, since I'm on the phone or on a Zoom with a UK, one of my favorite quotes is Winston Churchill, who said, "Never doubt the capacity of the American people to do the right thing after they've tried everything else," which I think has a lot of ring of truth to it. Another quote of mine about history in general is perhaps the greatest lesson of history is that we failed to learn from our own history. And that should be something that we think about as we move forward, so that we're making sure that people who in our movement understood what we have done. And I'm struck in my own life, and also like by reading William White's Recovery Rising, similar kinds of things, that as we learn about all the people that have come before us and did things, it leads to humility and like a deeper sense that we have an obligation to the next generation to do things that actually move it forward, and that there are many things that we could do to actually pull it apart. And we should be really mindful of those kinds of things. So our call to action, at least from my perspective, is to figure out what those common ground things are. We stand on the shoulders of all the prior generations who tirelessly worked to get us to where we are today. We must do the same for the next generation. And we must ensure that future years, people in need are met and embraced with a culture of recovery. And, I want to spend a little bit of time with some questions, and I'm very interested in any comments that you have. Invariably people ask me, well, what are those things that we should come together on? And I could give you my list, but they would be my list, and that's not right. It has to be things in that people that resonate with everything. I will tell you one thing that particularly resonates with me, that I suspect may resonate more broadly, and that is the research on recovery is that the longer we can sustain someone in recovery, the more likely that they are to stay in recovery. So the research shows I got into recovery at age 21. I accessed publicly funded care. I was met with a community of recovery. Um, I had a lot of challenges and barriers, but I made it through. By age 26, I had 5 years of recovery. And the research shows that at that time, that my chance of staying in recovery had increased. Every day in recovery increases my chance of staying in recovery. As that's true for recovery in general, but around 85% of the people who reach 5 years of recovery stay in recovery for the rest of their lives. And it seems to me that if I was designing a service system that included prevention, harm reduction, treatment, and recovery support services, my central question is, we know that the longer that we can keep people in recovery, the more likely they are to stay in recovery. How do we get people to 5 years, and how do we do more of those things? And if we changed our central question to that, it would mean we'd have to watch the processes. We'd have to consider multiple pathways of recovery. We would have to think about service interventions. We tend to only think about doing one thing or another thing. I suspect that we would find is that we would be combining things, or different things work for different people in different circumstances. And if we thought about it like that, we would probably dramatically change what we would do, and at the same time understand that recovery is a very individualized journey. This is true for things like cancer, where the research shows things that do work, but we also know that the human body is incredibly complex and individualized, and chemo may work with one person with one type of cancer and not work with the same cancer in another person. There are differences like that, and what they do is they try a different approach, and they stick with people, and their goal is remission, which is generally measured as 5 years. If we started to think like that, I think we could change what's done both here in the U.S. and national. And this is not my original idea. William White has talked about it. Researchers over here, including Robert DuPont, has talked about it. But it's something that I think has value. So I'm going to listen. I'm not sure if there are questions. I've tremendously enjoyed this. The only thing I love the UK. I've been to Scotland a couple times. The only thing I would have enjoyed more is doing this in person. But let me open this up and see what people have to say.
Thank you so much, Phil. Mom has a question. Teresa and we've been taking notes. Tobias, if you have any questions, please feel free. Mom, do you want to go ahead and then we'll just go around? Would you like to unmute yourself?
There we go. Yeah, sorry, my being in Texas with the UK laptop is just not good, so I've had to move to the iPad. So first of all, Bill, I am so grateful for you not only sharing this information, but every time I've had a conversation with you, I learn, and it just, yeah, it's amazing. So Ed Day, the UK recovery champion, talks about how we need parity between lived experience recovery organizations and big treatment providers. But what I see in my world is we don't even have parity amongst lived experience recovery organizations. How do we go about changing that? What have you seen to help create a level of inclusion where everyone is valued, and can all come together?
Well, and I think that's a really great question. And I've seen disparity in different groups here in the US as well. But when I would think back during that initial era, there was a sense that we all had something to gain together. And so that value of we need to raise all of our boats together is really important. What we did see here in the US, at least my observation is, I'll make two. One, our field has there's never been a ton of money in our space. And when I've got into this work, the only people who were really invested in it were people who wanted to do the work because there was almost no money in it. Due to some of the opioid epidemic and some of the public focus on that, there's actually a fair amount of money in our space. It's not reaching our communities of recovery, but it did bring in people who are interested in money. So we've had an additional challenge there. But if a value, both here in the US and there in the UK, of all of us together, we want to do things that raise all of our boats, that bring parity to all of us, because I will observe that part of our system sort of marginalizes us by having us fight among ourselves for scraps. And it harms us, but it also harms the larger community, because we are, in my estimation, the greatest underutilized resource that's out there is communities of recovery and what we can achieve through developing community resilience. So I'm not sure I gave you a full answer, but like, if that value and communicating that value is, listen, we want everybody to gain out of this, and that's our focus, could very well be the way to move that forward.
Thank you. I have a question that kind of touches on what you spoke about, the people who came in for money, right? We see that a lot, is like the self-serving rather than focus on the recovery community itself, seeking personal profits rather than like supporting the people. What are your advice, tips on that as we navigate the future of the recovery movement? How do we navigate that space? Because sometimes, right, like we're trying to just get by, pay the lights and get the work done, where we may not have the funds to look all fancy and bright and get in front of the, you know what I mean?
Yeah, I think it's true more broadly too. So that those idea of shared values and integrity, some ethics. I think I've had some discussion with some ethicists in our space about, the ethics of operating in our space. And I think if we start to develop a culture of ethical, transparent conduct, we do what we say what we do, that it will make it easier to spot those groups that are out for self-gain. And if that's something collectively we do focus on, I think that also reduces the chance of, what happens. I mean, here in the U.S., and you may be aware of this, but peer services sort of took off, and in some areas of our country, there are people who are bilking our public system by overbilling or doing things that they shouldn't, and those things harm all of us because it underlines this false concept that addiction and recovery are matters of morality, and so people think, well, look at those people are doing criminal things and they're all criminals, right? So having unethical conduct harms us all, and so having shared ethics may be part of that solution.
That actually kind of touches on my other question, because you had talked about policy and stuff. And, we hear that a lot is like the recovery community advocates for policy, for example, to get billable, recovery support services billable. And then people are kind of like, we thought that was the right thing to do, and then maybe it's hindered the recovery support later. So when you talk about advocating for policies and changes, what do you know what I mean? Because they thought they were doing the right thing at that time. And then now it's been overbilled, diluted.
None of us have a crystal ball. None of us can tell perfectly what will work and what will not work. But I think mindful discussions around that. So here in the U.S., and I know our systems are different, but putting peer services in our welfare programs, right, is a focus here. And so there's a lot of groups that they're moving to do that because they see money, and I don't blame them, because they're trying to just survive, and they see this as an opportunity to keep their programs open, and they see it as an opportunity to help. But the reality is, for many of us in recovery, moving back into employment and a full life is important, and so if we move it forward in one segment, we all should be advocating that there's funding beyond that, or ways to move people into productive living. And we should never do anything for people that they can do for themselves, and communities too. And I don't know if that makes sense, but that the service model is that this orientation of us doing things for people. The recovery model is helping people to do things for themselves, strengthening that community element. And so, things that do that. So we have to watch. I mean, we need money, but we have to approach it as, how do we get enough money to do things that are what we need to do, without that money itself becoming a hindrance or limiting what we could do. And that's what we've seen, where people get into this billable service thing, and then they're pursuing billable units. So they're on that service treadmill instead of the core concept of helping people get better and do things for themselves and their community. That service concept, community building concepts. So.
Thank you. Teresa, go ahead.
So this may be a little off, but it's something that stuck out to me. You mentioned we should be documenting our recovery histories, right? How can we do that when we're stigmatized as people in recovery by people who are not in recovery, right? And we've worked really hard to change that, but we also stigmatize each other. how do we tell our stories and how do we document our recovery history without, you know, the fear of being stigmatized even more by our own people?
That's good.
It's a good question, so we do have to watch that, and so you know, one then might ask questions to people who have been in the space for a while. You know, what were some efforts in your area to destigmatize, you know, different substances or people using different pathways of recovery? You know, so maybe emphasizing some leaders who had moved those balls forward in the generation that came before us, and understand, you know, that might be a way to sort of highlight that, and you know, to hold up recovery in all of its various pathways.
She said that's going to be the next movement. Come on in, Mom.
Okay, Bill. So 3 comments first. William White said that CCAR was the North Star and they were an envy because they created a stable, sustainable, self-funded model. You talked about the need to support people for 5 years in recovery, and many other people have talked about that. Me personally, at a point in recovery, I could start to add to my recovery by paying for some services. Some of my recovery capital was spinning classes, hiring a recovery coach. Some were free, on and different things. We talk about providing a menu of services. And so for me in England, I think we have a lot of services that initiate recovery. We don't have a lot that sustain and maintain for that 5-year period. How do we ethically, because I know what I do with heart and good purpose, make everything available that is free, sliding scale, paid for, so that if that is what people choose to access, the providers of that aren't stigmatized, but everything on the menu is made available. I recently supported a mom who her son went to the emergency room. She was only given the free options. She called me and said, how can you help me? I can pay for treatment. How do we make it okay to give people every option on the menu ethically and without stigmatizing the people who might be self-funded and just paying their light bills, but are still providing good recovery services? Sorry, that was a lot.
No, by the way, I don't think I'm the answer guy. Like, I don't have all the answers, but as you were talking, I was reminded, and I had the, like, probably the greatest honor of my life was William White, you know, calling me up and asking to read his comments to the National Institute of Drug Abuse and the Harvard Institute first recovery conference. And so I did read those words, and I actually I read that document 100 times so that I could do that. And he, you know, he talked about furthering recovery research, and he referenced different ways of knowing, and that recovery should inform all the different ways of knowing, not just academic understanding, but we have to be mindful of community understanding of things and various different ways that things are understood, not to overvalue, you know, academic research, but also to value things that come from the recovery community, and even, you know, histories and folklore and things like that. But I suspect that a lot of the kinds of things that people find in their communities that help them find recovery are things that make all of our society stronger. And you know, we're seeing an erosion of community here in the U.S. Because of things like social media, political strife, and things like that. And I also suspect that we're not quite alone in that. But I think if we started to research what people can access in their community that's even for free, that it would give, you know, more value to expanding these things for all of our society, and that might help keep it from being just another way for people to, you know, corner a market or something like that, if that makes any sense. I suspect that there are some answers there.
Yeah, thank you. Tobias, come on in, sir. Did you have a question?
Well, yes. Hi, sorry I got on here late, but
You're good.
I see that you're recording it. I'm hoping that it is. My first question is it
Yeah.
going to be available to listen to at a later time?
Definitely. We had a glitch in the system, so we recorded it. So
Gotcha. Okay.
we'll definitely share it with you.
Perfect, because I had a few people that wanted to come on today, weren't able to, so I'm gladly share that. What I keep in my experience in the recovery community is very limited to the last year or so, and I'm a support coordinator for a recovery center in northern Michigan in the United States. And what I'm experiencing, or what I'm seeing in the 21 counties that we service, is it sounds like this is what you're speaking to, Bill, is that there is a there's a nervousness around the secularization and funding of recovery. To me, it reminds me of the history, the movement of Christianity, where it starts as a grassroots, heart-led, all hands on deck movement, and then becomes popularized, secularized, and funded and diluted across the board. So to me, I'm wondering if you see what I'm speaking to here, in this, and do you see what I'm seeing is that it looks like there's going to have to become more of a movement towards deconstruction of some of the secularization of the recovery movement in some ways. If you're going to gain that power back of giving that power to people in recovery, to have that their recovery is their recovery, and having them get hands on deck to move it forward versus just going somewhere and getting something that they need.
Yeah,
I'm not sure if I'm saying it all the right way, but I see dangers in the us versus them. I'm seeing labeling becoming a thing. And those things are signs to me as a historian that there's a danger there. So
yeah, I'd love to talk to you further about things that you're saying, but I do, if I have the sense of your question right, as you were talking, I was thinking about that 2013 paper that William White wrote after his presentation in Dallas, and he said things in it like, if the recovery movement simply becomes about furthering peer services, we will have failed. And taking the energy of a community and turning it into a service, and then that becomes this formalized process, and people see recovery community as the same thing as peer services, and certainly they are not. And we may well have to deconstruct some of those things, and I suspect if we really start to value again recovery community, we start to see all those nuances and potentially could reduce some of that infighting and labeling and all kinds of things. And again, one of my interests in spending some energy on this stuff is I'm deeply concerned about where we are. And I also wrote I write a lot, but I wrote something on all social movements end, when will ours? And I kind of reference some concerns that I have. And I hope I'm wrong there, but that does tend to happen. They do go their course. And one other thing I will say is this. It was one of the questions that I interviewed people who had longer institutional memory than me on this. And people like Phil Valentine of CCAR were instrumental. And a number of them, Tom Hill, Phil Valentine, and others, referenced that recovery always finds a way. And the sort of humility that humans mess things up. I mean, we build things and we mess them up. And it's part of our nature. But that recovery always finds a way. That there will come another movement after even if we screw this up or when we screw it up, another movement will come. And what we could do though is help that be the fall be shorter and of less space, doing the things that we're doing, but also to recognize that that we are fallible, and to take a look at ourselves and what we're doing, but then also know that not all is lost, even when things seem like they are, that it grows again, like the image of that phoenix, which is not this thing that pristine rises up out of the fire, but it barely gets off the ground in a mess that it is, and takes the sky barely sometimes, but the phoenix rises again.
Thank you.
And Tobias, I'll just say that paper, because I sent Tobias that Future of the Recovery Movement, and it talks about mission drift and pitfalls and things like that. That paper has a lot of what you're talking about as well, that William White wrote, which was really amazing.
Thank you. I'm going to check it out. I already saved it. So
yeah, no, definitely. I have a question, Bill, which I think that you're a great question answerer. So you can answer questions all day for me personally. Talking about what's happening and everything, you also spoke about key advocacy skills. And like, I was reading recently about advocacy, in the current landscape of today, and we see lots of like you mentioned, social media and things like that, but the depth of the advocacy movement sometimes isn't the same as it used to be. People, you know what I'm saying? So like, if we're talking about advocacy skills and what that may look like going forward, what are some lessons maybe learned, or what are your thoughts around that?
Yeah, and I going off of what Tobias said, and I agree with him. Like there's this parallel of that early grassroots, everybody on board, all hands on deck, we're all in this together thing. And I think what has happened as the thing has matured and formalized is that people are seeing very different things, and advocacy can become much more narrow, or it's sometimes in opposition to each other. And I'll go back to that point of where is our common ground, because we will burn each other down. Stigma is so deep that the more infighting that we do, the more society looks at us as not being a community of consequence. So it is imperative for all of our interests to find that common ground. Those of us in the recovery lane, and work on those things. Those are things that if we find them, and a lot of people say, listen, this is that grassroots thing that is worth all hands on deck. I think that's what we get back to. But the only way to get that, I could jot 3 things on a piece of paper, and some people would agree with them and some people wouldn't. But what's more important is it things that groups of people, after talking, can come together on. And that narrative, I think, could help us. That dialogue, rather, could help us strengthen advocacy by strengthening the primary things that we're focused on.
Thank you so much. I just want to also say thank you for your time. Does anybody have anything else they want to ask or whatever before we wrap up? Anything else? Tariq, do you have any other questions, Tobias? I'm sure that we'll all have other things that come up later, Bill, and we'll just be contact. Hey, what are your thoughts about this?
And I'm interested in your thoughts too. And it's an honor to have been here, and I'm really grateful for the opportunity, and also thank you for all of the work that you're doing. I do think that we're all in this together.
Yeah, definitely.
And so that's why I'm doing it, because I want to see the generation that comes after us to get as much or more than I had, and I think probably others feel that way too.
How are we supporting our future leaders? Like I say, Bill, can I just ask, as we wrap up, what are your top 3 lessons from history that we should keep in our vision as we move forward in the world?
Learn from our history. Take the things that have worked for other groups that apply to our current time. The idea of coming together on common ground issues, and then look at mistakes that others have made in history, getting involved in things outside of our lane, infighting, commercialization, self-gain over we. Those are the things I think are most important to learn from.
Well, what a great way to wrap this up. Thank you so much. And
Thank
y'all
you.
for joining. And we will share this out. We will get it all uploaded. Bill, I'll email it to you as well so you can share it out however you want. We'll post it on social, etc.
I'd love to. Thank you.
Awesome. Thank y'all. Bye, y'all.
Take care. Bye.